When the coronavirus pandemic began, the health department in Teton County, went all in on contact tracing. Everyone at the health department stopped their regular jobs to join the effort, and each person who tested positive in the county, home to Jackson and Grand Teton and Yellowstone National Parks, got a call. But when the Omicron surge hit this winter, the numbers were just staggering, says Health Director Jodie Pond. At one point in early January, the county had the highest case rate in the country. When the health department got too overwhelmed to call everyone, she says, the community noticed right away. Our phone lines were just ringing off the hook the week before Christmas, because people were like, I haven't heard from you. They went on local news to tell residents what was going on. We had to make sure they understood that they wouldn't be getting a call from us, Pond says. With 1 full-time and 4 part-time staffers, the health department had to prioritize who would get a call. They decided to focus on people over age 60, people who might not have access to medical care, and those who tested positive in group settings like daycares. It was hard because we didn't want to let our community down, she says. But, as a small health department in a rural county with, at the peak, more than 275 cases in one day, she says, we just had to make the pivot. With Omicron, the sheer number of cases was completely unmanageable for contact tracing programs in many places. In Fulton County, Georgia, Chief Epidemiologist Fazle Khan says, they have 130 people on their contact tracing team, as many as they've ever had. It still hasn't been enough. We ended up, in Fulton County alone in this Omicron surge, with more than 44,000 cases that have not been investigated, Khan says. In Maryland, during the Omicron surge, we really were only able to reach out to 11% or 12% of the cases, says Marcia Pearlowitz, chief of the Maryland Department of Health's Contact Tracing Unit. Before Omicron, they had reached 76% of residents on average, she says, even during previous surges.